Hello, my name is Anat Baniel. Thank you so much for taking the time to watch this overview DVD of the Anat Baniel Method for children. In this DVD, you will see 15 different children with the different categories of disability. Each child we've edited down to 2 minutes with a voiceover by me. The work is done both by myself and by some of the practitioners I've trained. Today, there are roughly 200 Anat Baniel Method practitioners. Most of them are situated in the United States, but there are a few in Israel, in Egypt, in Singapore, and a few in Europe. I would like to take just a moment to tell you a little bit about the Anat Baniel Method for children. This method is scientifically based. It is primarily based in the understanding of what the brain requires in order to form new patterns and new configurations of action. So when we get a child with special needs, we do not try to cure that child. We are not a medical approach, but rather a learning-based approach. No matter what the condition of the child, we always look to see if we can find a way to communicate with that child and that child's brain to help it form new patterns that will help the child get past its own limitations. I have identified 9 basic requirements, which I call the 9 essentials, that when the brain is presented with those essentials, it gets the information it needs in order to begin forming patterns very quickly and very efficiently. And with children, it is done even faster than with adults. The first and most fundamental essential is what I call movement with attention. Movement helps the brain both grow and organize. And we do the work in such a way that the child notices what happens to it. Even an infant that is a day old begins paying attention to the sensations that they get through the movement. As you will see when you watch the children on this DVD, the changes happen sometimes so rapidly that it looks like almost miraculous, or as if they didn't have the difficulty to begin with. With other children, the process is much longer. But in each and every session, we'll look for the child to acquire a few new patterns. That means for that brain to always be creating new possibilities that helps the child move into its future. So we are not very focused on the limitation, but we are focused on what the child can move to do. And over the 30 years of my work with thousands of children and the many practitioners now that do this work, we have discovered that over and over again, this approach basically absorbs a great degree of limitation and allows the children to have fuller and fuller lives and more successful lives. So now let's get to the actual children. Thank you. This is Eli. He's 5 months old and was referred to us by Dr. Woodard, the pediatrician, who just diagnosed him with a cerebral palsy. His hands are most of the time in his mouth. He never rolled on his belly before. And here very lightly, you see he already rolls on his belly. This is Marcy Lindheimer, an ABM for children practitioner. Now look how the child listens to himself and feels his own body, and there he will push himself in his own initiative. We do not impose on the child. We look for the child's brain to recognize what is going on and initiate their own movements. Eli had a severe scoliosis in his lower back from birth. A few weeks after we started working with him, the spine got straight, and look at his hands got very free. And here he initiates crawling on his own. His left side is still a little bit more spastic, but still he can manage movement with it very, very well. And here he's just happy, which is nice to see. We don't impose on the child. Here with a very light touch, I helped him come on his hands and knees, and I help him bend the left leg, but when he straightens it, I won't insist, because we don't impose. We look for the child to recognize what they're doing and to initiate movement like all healthy children do. And look here, that's an example of that. This is Tim. He was 8 years old when I began working with him. We do not have video of the initial lessons, but he couldn't even lie flat on the table. He was not able to talk. After the first 2 lessons, his back and chest and breathing improved so much that he began talking non-stop, and his mother, a veterinarian, jokingly asked if I can take it back. Here you see him. He has developed remarkable capacities and organization in the gravitational field. I'm actually instructing him what to do, and he's following it. Look here, he's sitting, and how beautifully, and he corrects the head when it goes sideways. Here I'm giving him instructions to take his leg behind, and look how well he follows it. He couldn't even sit up when he was first brought to me, and obviously had a huge improvement. He's a very intelligent boy, so I give him lots of verbal instructions to enhance his awareness of his own body. In a minute, I'd let you listen in to a bit of the lesson and how I communicate with Tim. Go down to put your feet, look to find the floor, not wait for it to be first cool. That's it, excellent. Push up with the belly forward, just like you did on your knees. That's right. And put your feet, look to find the floor. That's right, and push forward with your belly. Spread your leg, put both legs down, spread it. That's it, and push the belly forward. This arm too. Push. That's good. Now keep pushing me. Fantastic, now keep pushing me. Keep pushing me. Push me. Hey, both arms, push me. Hey, you forgot the arms. Hey. And now you can see how his lower back is working so much better. He didn't even know he had a lower back when he came to me. So all the therapy that was done with him really, to a great extent, did not do much. Look how quiet he's here, how much he can do, and in a minute you'll see what Tim can do now. You see, he simply knows how to stand up, and he walks on his own. Quite remarkable.